We continue with interviewing techniques, still on thirst, appetite, and taste. Preference for cold foods signifies heat patterns. Preference for hot foods would mean cold patterns. Poor appetite or easily satiated, spleen qi deficiency. No appetite in the morning would signify stomach and spleen qi deficiency, damp phlegm. Insatiable hunger or becoming hungry shortly after having eaten is stomach fire. Aversion to food is food stagnation. Acid reflux signifies stomach fire. Nausea after eating, spleen qi deficiency, food stagnation. Nausea caused by emotional pressure and stress is liver qi stagnation. Nausea caused by hunger, spleen qi deficiency. Nausea during the premenstrual period is liver qi stagnation. Morning sickness would signify rebellious qi in the chongmai, stomach and spleen qi deficiency, liver and stomach fire, liver qi stagnation, stomach yin deficiency. Acute vomiting is invasion of exogenous pathogenic factor, food stagnation. Chronic vomiting means food stagnation, damp phlegm, liver qi stagnation, stomach fire, stomach and spleen qi deficiency, spleen yang deficiency. Explosive vomiting, excess patterns, thin, slimy vomit is damp phlegm. Sour or bitter vomit means heat in the stomach, liver, or gallbladder. Clear and watery vomit that is odorless, cold in the stomach, or spleen yang deficiency. If there is blood in the vomit, that means there is blood stagnation or stomach fire. Burping with a taste of food that has been eaten earlier is food stagnation. Imbalances of the various organs can result in a person being attracted to specific flavors. This is most typically seen when someone who is spleen qi deficient has a craving for sweets. The problem is that they often respond to the signal by eating sweets, cakes, or other things that have a high sugar content and have a very concentrated sweet flavor. This will overload the spleen and create dampness, which further weakens the spleen. This causes the weakened spleen to crave more sweet food. The consequence will be that because the spleen is even weaker, the craving for something sweet will be greater and a vicious cycle begins. The craving for the other flavors are not as evident in imbalances of the other organs. It is interesting how many people are attracted to the bitter flavor of coffee. Certain flavors can be appealing to some people, not because of the organ that the flavor resonates with, but due to the energetic dynamic of the flavor. For example, the spicy flavor is very dynamic and can help to disperse stagnant qi. Imbalances in Zangfu organs can also manifest with a person experiencing a certain taste in their mouth. Bitterness is the taste that relates to the fire phase. If the person experiences a bitter taste in their mouth, often they will describe it as a bad taste or a metallic taste. It will not necessarily be a heart imbalance. The fire phase resonates with fire and heat in general. This means that a bitter or metallic taste can be seen when there is fire in the stomach and liver, as well as the heart. Liver imbalances can manifest with a sour taste in the mouth. A sweet, sticky taste or sensation in the mouth will be a sign of dampness or phlegm. The person will sometimes brush their tongue to get rid of the sticky sensation that often accompanies a very greasy tongue coating, which in itself can be a sign of dampness and phlegm. It is important to remember that some medicines can result in an unpleasant taste in the mouth. It is important to assess whether the taste is due to a change in the body's physiology. For example, a bitter taste has a reason because medicine has created heat in the body, or whether the taste itself is from the medicine and therefore has no diagnostic significance. Lacking a sense of taste is mostly a manifestation of spleen qi deficiency, but can also result from phlegm in the lung that clogs the nose and sinuses, or blood stagnation in the nose after a physical trauma. This is because aromatic flavors are discerned in the nose. Craving for sweet signifies spleen deficiency. No sense of taste, spleen deficiency, lung phlegm, or blood stagnation. Sweet, sticky taste in the mouth would mean damp phlegm. Bitter or metallic taste in the mouth, heart, liver, and stomach fire. Sour taste or taste of previously ingested food is food stagnation. Thank you for your attention.